Hello everyone, welcome to Lemon Tricks, where concepts are made easy. Today let us learn few more topics from the first unit, Introduction to Health and Illness from the subject Nursing Foundation 1. So please take a notebook and a pen, note down the important points as we learn together about the topic. So now let us learn about illness-wellness continuum. Continuum means something that develops gradually over a range without any breaks. Okay, so here this illness wellness continuum, it's a graphical illustration. If you see the slide, it shows a graphical illustration, and the main concept about this illness wellness continuum is about the well-being concept. So this continuum was first proposed by Travis in the year 1972. It proposes that the well-being includes mental and emotional health as well as presence and absence of illness. So here the main idea about this illness-wellness continuum is wellness is always a process. It is not a static one. It means wellness is not always constant or same all through the life of a human being. It changes or it is not always in a static state. So that is clearly depicted in the continuum or the graphical illustration which you are seeing. So the right side of the continuum reflects the degree of wellness, whereas the left side indicates the degree of illness. Moving from the center towards the left shows the worsening state of a health, and moving to the right from the center, it indicates the increasing level of health and well-being. And you can also see the treatment paradigm there, where it shows about the disability, signs and symptoms. So in simple, a person's health is deteriorating or worsening, he or she can move towards the neutral point with the help of this treatment strategies. Okay, so if they are facing the disability, signs and symptoms, with the help of the treatment from the worsened state, a person's health can move towards the neutral point. And that neutral point will not be the end. With the help of the wellness paradigm, you see the arrow there, with the help of awareness on health, getting educated about health and improving their health, they can move towards the high level wellness. So if you become ill, in simple, if you become ill, treatment is most important. But don't stop at the neutral point where you get treated for the symptoms or the signs or the disease condition, and you get into a neutral point, and you should not stop there, but instead move towards the wellness paradigm, towards the highest level of wellness. So here the illness and wellness continuum proposes that an individual can move farther to the right towards greater health and well-being. So how he or she can move towards the high level of wellness? Through awareness, education and growth. So in the same way, worsening state of health is also reflected here in the left side, you see. So it is reflected in the form of signs and symptoms. So altogether, a person's outlook also will play a major role in this continuum. For example, a person who has no symptom of a disease or a disease condition is constantly complaining about some or the other sign. So he will be always or she will be always away from the high level wellness. In the same way, a person with disability but tries to maintain a positive outlook will always try to move towards the high level of wellness. So this is the main idea of the illness wellness continuum. Remember, the core point, the first thing is wellness is always a process and never a static one. It changes, and a person's outlook can also change, whether he can move towards the worsened state of health or towards the highest level of wellness. Now let us look into the factors influencing health. Many factors influence clients' health, beliefs and practices. So the health beliefs of a person can influence his or her behavior related to health as well as their practices related to health. So these factors can be positive factors and sometimes negative factors which affects the client's level of health. So, as a nurse, understanding the effects of these factors or variables will allow us to plan and deliver the care individually according to the need of the client. There are two types of factors influencing the health. First one is the internal factors or the internal variables, and the second one is external factors or the external variables. So, internal variables, these are the factors that are within the individual that influences the health, behavior as well as the outcomes. Whereas the external factors or the variables are the factors which are present outside the individual, which may influence the health, behavior and the outcome of a client. Now let us see some of the internal factors influencing the health. The first one is the developmental stage. So the health belief of a person change according to their stages of growth and development. For example, the health belief of an adult is different from that of a child. So, the nurse must consider the client's level of growth and development while she plans the care for the client. Maybe the sick children may exhibit more of fear and anxiety. So, the concept of illness mainly depends upon the developmental stage of a child or the adolescent or the adult. So, that is the first variable, that is the developmental stage. The second variable is the intellectual background. A person's health belief is always shaped by the factors such as the person's conception about their own body function, illness, knowledge level about health, their educational background, past experience. All those falls under the intellectual background, which can also somehow influence the health pattern of an individual. That is the second factor or the second internal variable. The third internal variable is the perception of functioning. So here if you see, people differ in their perception about their physical functioning. While doing assessment, the nurse can gather the subjective data about how the client will think about his physical function, and especially about the level of fatigue or whatever signs or symptoms they express. And also she can go for the objective data about the actual functioning of some vitals like blood pressure, heart rate, lung sounds. All these things can be taken or measured by the nurse. So this helps the nurse to successfully plan and implement the care she wants to give according to the need of the client. So that is called as the perception of functioning. And the next factor is the emotional factor. So here the client's emotions such as stress, depression or fear also can influence the health belief and practice of a client. So for example, a client who is very calm may have little emotional response during illness, but an individual who is depressed or in stress may sometimes overreact even for a minute illness. So in such a way that the emotional factors can also influence the health pattern of an individual. And the next internal variable is the spiritual factors. Spirituality also plays an important aspect related to health or in terms of health. Religious practices are one way that people exercise spirituality, right? So some religions restrict the use of certain forms of medical treatment. So as a nurse, we have to understand what are the client's spiritual levels, so we can involve them in our nursing care. So these are some of the internal variables that influence the health factors or the health levels of a client. The second variable is the external variables. The second factors or the second variable is the external variable. So some of the external variables which influences the health pattern is, the first one is the family practices. So the health of an individual depends on how his family uses the healthcare services. Okay, family's response to disease and how they prevent those disease can also influence the health of a family member. So the first external variable is the family practices. The second variable is the socio-economic factors. Social as well as psychosocial factors can also influence the health and health practices of an individual. So mainly the a person's marital or intimate relationship can also influence the health pattern of an individual. Lifestyle also can influence the way they use their time, or the sedentary lifestyle can also affect their health. So all those comes under the lifestyle habits. Their occupational environment, the area they are working in, or the exposure they have in their occupational area. So all this falls under the socio-economic factors which can influence the health pattern of a client. And the third external variable is the cultural background. So cultural background of the individual influences health and health related practices. So in simple, it is how an individual believe about the causes of illness, the treatment, or practices to restore health. So the nurse always should be aware about their cultural practices about their clients, so they can understand the client's behavior and provide better and comfortable care. Stay with me for part 3, where we'll cover the remaining topics. If you found this video helpful, like, share and subscribe. Thank you for watching.